Several questions here about diet issues and revisiting the vitamin question. So, any data on gluten-free diets? Any relationship with vitamin D? Somebody else asked about diet drinks. Go ahead. And someone else asked about, is there any relationship between polio and cognitive loss?
All great questions. So let's talk about diet first. So there has been research on diet and its influence on Alzheimer's disease risk. So the so-called Mediterranean diet has come up again and again in research studies as being a good one. The Mediterranean diet is not what you get at a Mediterranean restaurant. But it's a diet that's rich in fresh fruits and vegetables, fish, a little bit of poultry, really not much red meat, olive oil, nuts, red wine, those kinds of things seem to be good for the brain, seem to be to help prevent some of those vascular risk factors that I mentioned, prevents type 2 diabetes, is associated with long-term brain health. Vitamin D, these other vitamins that I think you mentioned, again, we just don't know a lot about how they might influence Alzheimer's disease risk. Polio, no direct link between polio and cognitive decline, at least none that's really been demonstrated in good studies. That being said, I think that polio is an example of something that might cause brain, sort of subtle brain damage early in life. In the same way that a mild head injury might cause, a subtle brain injury early in life. And the accumulation of all the things that happens to our brain over, 70 or 80 years of living can influence the time at which Alzheimer's symptoms might come out.